Have you ever wondered why damage to the median nerve makes it almost impossible to pinch or grasp objects no matter how hard you try? Let's break this down in a way that will finally make sense. Welcome to this quick preclinical anatomy review, perfect for your USMLE Step 1 prep. Let's start with the median nerve itself. It originates from the brachial plexus, specifically the lateral and medial cords, and travels all the way down the arm. What makes it so critical is its innervation of most of the flexor muscles in the forearm and the thenar muscles in the hand. This is why an injury here doesn't just cause numbness, it leads to profound weakness in thumb opposition. One of the classic clinical signs you'll be tested on is the ape hand deformity, where the thumb can't oppose due to thenar muscle atrophy. If you see a patient who can't make the OK sign because the flexor pollicis longs and the flexor digitorum profundus of the index finger are paralyzed, you're likely looking at median nerve damage. Here's a practical tip. Always remember the sensory distribution. The median nerve supplies sensation to the lateral 3.5 fingers on the palmar side, which is a high yield point for your exams. Another must-know fact, in carpal tunnel syndrome, compression occurs under the flexor retinaculum, affecting the median nerve but sparing the palmar cutaneous branch, so palm sensation remains intact. Understanding these small but crucial details will help you nail related questions in USMLE Step 1 and avoid confusion during clinical rotations. If you want the complete PDF guide covering all major anatomical pathways, nerve injuries, and high-yield clinical correlations with clear diagrams and mnemonics, just click the link in the description below. Make sure to subscribe to the channel, hit that like button, and share this video with your classmates so you can all stay ahead in your medical journey. And remember, the full preclinical anatomy review is waiting for you. Grab it now through the link in the caption before your next exam sneaks up on you.